Hey y'all, it's Dr. T checking in. Okay, so we're about 2 weeks out from the second surgery and we are in urgent care because I was having some really bad pain in my arm, my left arm. And when I was kind of like feeling around in that area, it felt like pain in like a vein. And I did not want it to be a blood clot or anything like that. So came right to urgent care because the main provider I had been trying to get in touch with since Tuesday, I was just unsuccessful. I called a couple times, sent in my chart. I have yet to get a response. So decided to come to urgent care today because I didn't want the weekend to go by, and then I just am stuck trying to figure out what to do or anxious about this pain in my arm, which is pretty intense. So that's what we're doing right now, and just hoping and believing that I get a provider that finally hears me and takes this serious, because that has just not been my experience overall in this system. So still working through that, still trying to decide if I will do anything about what happened to me post-surgery with the mismanagement of meds. So we'll see. Hello. So the doctor came in and did his exam. He asked me quite a few in-depth questions. Thankfully, he was very, very thorough. He had reviewed my entire case. He knew what had happened in surgery, what had happened post-surgery, and he asked very thoughtful and insightful questions, and ultimately decided that he agreed with me that there was a concern for blood clots, and so he called over to a smaller emergency room instead of the larger hospital, and was able to get my name on the docket. So they were expecting me, so I was able to be seen right away. Hey guys, I'm back. And as you can see, I'm in bed. So we had the appointment in urgent care. They actually agreed with me about the concern about my arm hurting, and called over to the ER, had me on the roster. So when we got here, I was able to be seen, and the radiologist actually just came in to confirm that I actually have 2 blood clots on the exact area that I've been complaining about pain. So I have one that they said is like more internal and deep, and then there's one that's a little more superficial in that same area. And they said they're quite surprised because normally they show up in the calves behind the knees. And so yeah, I was right. And just another example for you all to trust yourself. Trust yourself. Like, I've never had a blood clot. I don't even know, like, I honestly just wouldn't even know what the symptoms were, but I felt the pain, and that was immediately the thought that came to my mind, which I know is just the Holy Spirit, like God really like dropping this wisdom into my spirit, because I would have not known otherwise. I would have not known to ask them. I would have not known to tell them, like, this is my primary concern. And so I'm just really glad that I listened to myself. I trusted myself. And so now they are consulting with the radiologist, is consulting with the oncologist to gauge whether the blood clots will need to be removed surgically, or whether they can give me medication to help with them dissolving on their own. So some of the primary things that are of concern is the fact that a specific type of blood thinner would need to be used, because I still have the incision in my back, and we don't want more blood flow to that area. So that's another consideration that needs to be made. And so they're consulting, and I'll be consulting and we will come up with a proper game plan. So not sure how long we'll be here. As of yet, it's a little after 7 p.m. now. So we've been here since about, I think we got to urgent care about 1:30 today. So it's been a long one. But again, really glad that I did not wait. Really glad I did not go into the weekend with this pain, because as the radiologist noted, that they could move. Those clots could shift and move and cause stroke, cause aneurysm, cause who knows, right? So I'm just thankful that I acted on my instincts and got some answers. So try to keep you all posted as we know more. Just continue to send the prayers for quick resolution and continued healing. Hey guys, checking back in. It is 9:15 and we are leaving the emergency room. Finally, thanking God that I did not have to have a surgical procedure. They checked with the integrative oncologist, who confirmed that the blood clot is not severe, they said, and so it does not require surgery, and that they believe with a low dose blood thinner that it will help my body metabolize it, and all should be well. So they gave me a prescription for a blood thinner that I'll be taking, and they confirmed with my spinal surgeon that it's a safe window of time for me to actually take blood thinners without causing the incision in my spine to open up or bleed unnecessarily. So all of that was confirmed. We're heading for the blood thinning medication that I'll start tomorrow, and they gave me just a few signs to watch for. They said everything, that the risk is very, very low that anything would, be worsening, but they did say that sometimes people experience shortness of breath and like weakness, and if that's the case, then I absolutely need to go to the ER, because they said that means that it could potentially have traveled to my lungs. And so ultimately they just confirmed for me that I made the right choice by going in, because the pharmacist just straight said, like, worse things happen when people don't, and in some cases people die from blood clots. So just grateful and exhausted. Grateful and exhausted. Just really tired. Ready to rest and to not have to deal with the medical system. So that's all I got for today. If you learn nothing else, okay? You learn nothing else from this. Learn that you have to be your own best advocate, okay? You have to advocate for yourself. You have to know your body in all scenarios, right? My initial breast cancer diagnosis in 2020, I found the lump. My back, I knew something was wrong and forced their hand to continue to give me scan after scan after scan until they found what was wrong, right? This situation, my arm was hurting abnormally, which I also recognized that I have a really high pain tolerance. And so if I'm saying, this feels like an 8 on a scale of 1 to 10, it's really like a 10 or an 11 is what I've learned about myself. So I have to take those things serious. And so if that's you, right, like, take those things serious. Trust yourself. It's always better to act out of an abundance of caution and save your life than to not act and suffer consequences, right? So that's all I got. I'm just gonna get some sleep tonight. I'm gonna sleep in tomorrow. Our whole family's sleeping in tomorrow. And we're just gonna lay around all day tomorrow and just relax, because this has been a doozy. So yeah, we'll check in again soon.